Okay, Doc. Okay, good afternoon. Visual diagnosis, inspection, prognosis according to complexion color. Prognosis according to complexion of color. Observation, complexion color is used to determine prognosis in four ways. Firstly, by determining the presence of or absence of luster. Second, by paying attention to the thickness of the color. Thirdly, by analyzing the conforming or rebellious nature of color according to its movement between areas of the face. The fourthly, by analyzing the complexion color in its conformity to or deviation from the seasonal influence. Part 1, presence or absence of luster. If a pathological complexion color is bright, lustrous, and contained, it is a sign of good prognosis. If it is dark, lusterless, and fully revealed, it is indicate poor prognosis. Origin of medicine, 1861 says, the sheen of the complexion consists in luster and body. The luster means that the complexion appears clear and bright from the outside. Body means that it is moist and with luster in the inside. If the complexion has such attributes, even if the color is pathological, it indicates that the mind and spirit are stable and unaffected, and therefore the prognosis is good. In chapter 10 of the simple question, differentiates between the good prognosis and the poor prognosis by observation of the five main pathological colors, comparing them with various objects that were in common daily use in ancient China, some of which will be familiar to Westerners. The colors are as follows. In pathological color, green, feather of a kingfisher is a good prognosis. Dead grass as a poor prognosis. In pathological color red, a good prognosis is rooster comb, but in poor prognosis, stagnant blood. Pathological color yellow, the good prognosis is abdomen of the crab. Bitter orange in poor prognosis. In pathological color white, the good prognosis is pig's fat. Dead bone color for the poor prognosis. And pathological color dark, the good prognosis is cross feather and coal ash for the poor prognosis. The same chapter also described the five main healthy complexion colors, again comparing them with various objects as follows. In organ liver, healthy complexion color is thin piece of white silk covering a dark purple one. In organ heart, the healthy complexion color is thin piece of white silk covering cinnabar. In organ spleen, thin piece of white silk covering snake gourd fruit is the healthy complexion color. In lungs, thin piece of white silk covering a pink one is the healthy complexion color. In organ kidney, a thin piece of white silk covering a purple one for healthy complexion color. It is interesting to note that the normal healthy colors are described as being covered by a thin piece of white silk, which means that they should be rather subdued and subtle. It is also interesting that pathological colors are latent and manifest themselves when the thin piece of white silk is removed. In chapter 17 of the simple question, describes the look of pathological colors with or without luster in slightly different way. A red complexion should look like vermilion covered with white, not like ochre. A white A white complexion should look like feathers of a goose, not like salt. A blue complexion should look like moistened grayish jade, not like indigo. A yellow complexion should look like real gar covered with gauze, not like loose, the soil in North China along the Yellow River Basin. A black complexion should look like dark varnish, not like grayish charcoal. Dr. Chen, she do in Secret Records of the Stone Room, 1687, goes as far as saying, if the complexion is dark but with Chen, the person will live even if the disease is serious. If the complexion is bright but without Chen, the person will die even if there is no disease. If the complexion color is bright, lustrous, and contained, it indicates that even though there is a pathological state, the internal organs are not weakened. Pathogenic factors are not too strong. Stomach chi is still relatively intact. The disease is mild and the prognosis is good. If the complexion color is dark, lusterless, and fully revealed, it shows that the internal organs are weakened. Pathogenic factors are strong. Stomach chi is exhausted, the disease is severe, and the prognosis is poor. Part 2, thin or thick color. Okay? The thickness of the patient complexion color is directly related to the intensity of the pathological condition. A thin and superficial color indicates either an exterior disease or a light pathogenic factor, while a thick and deep color indicates an interior disease and a strong pathogenic factor. Therefore, a change from a thick to a thin facial color indicates that the pathological factors are getting weaker and the disease is retreating. By the contrast, a change from thin to a thick facial color indicates that the pathogenic factors are getting stronger and the disease is advancing. Part 3, the conforming or rebellious color according to area of the face. Okay. The conformity or rebellious nature of a color must also be related to any movement of the color from one area to the face to another, of the face to another. A movement of a pathological facial color from the top to the bottom part of the face indicates an improvement of the condition and it's called conforming movement. By contrast, a movement of pathological color from the bottom to the top part of the face indicates a worsening of the condition. It is called rebellious movement. The simple question in chapter 15 relates the conforming or rebellious movement of a facial color and therefore the prognosis. Also to the left or right side of the face, making a distinction according to sex. In women, color on the right side indicates a rebellious color, while on the left side it is conforming. In men, a color on the left side indicates a rebellious color, while on the right side it is conforming. This passage correlates the prognosis to the location of the pathological color on the right or left side of the face in men and women. For example, in women, an excessively red color is always pathological, whether it is on the right or left, but it is worse if it is on the right cheek. Vice versa applies with a man. Part 4. Conformity or deviation of color according to season. The complexion color should be assessed carefully in the light of seasonal influences. If the influence of climatic factors of the season exceeds that of the pathology of the five yin organs, it is a sign of good prognosis. If the influence of the pathology of the five yin organs exceeds that of the climatic factors of the season, the gesti, it is a sign of bad prognosis. The chapter Keys to the Four Diagnostic Methods and the Golden Mirror of Medicine says, the chi of the five yin organ manifest with the five different physiological colors in accordance with the five different types of body shapes, such as such colors will never change and are called dominant colors. The colors influenced by the climatic factors of the four seasons will change accordingly and are not the same all the time. They are called the guest colors. The climate in spring corresponds to the liver, and the complexion color is relatively green. The climate in the summer corresponds to the heart, and the complexion color is relatively red. The climate in autumn corresponds to the lungs, and the complexion color is relatively white. The climate in winter corresponds to the kidneys, and the complexion color is relatively dark. The climate in late summer corresponds to the spleen, and the complexion color is relatively yellow. These colors are seen when the climatic changes in the seasons are normal. The dominant colors are manifestation of the five yin organs, while the guest colors are produced by the climatic changes of the season. Therefore, when observing the complexion color, if the influence of the climatic factors of the season exceeds that of the five yin organs, it indicates of the guest color replacing the dominant colors is a sign of good prognosis. If the influence of the five yin organs exceeds that of the climatic factors of the season, it is a sign of poor prognosis. That is why it is said that the dominant colors overtaking the guest colors is a sign of poor prognosis. The so-called replacing of the colors is found in the following situation. The, com- the complexion color should be green in spring but is white instead. The complexion of color should be red in summer but is black instead. The complexion color should be white in autumn but is red instead. The complexion color should be black in winter but is yellow instead. And the complexion color should be yellow in late summer but is green instead. Reading the above quotation, it should be noted that a poor prognosis is indicated when the dominant color becomes pathological when it manifests in the wrong season, and specifically when it belongs to the element that overacts, a long overacting cycle on the element of the particular season. For example, having a yellow complexion in springtime instead of greenish indicates a poor prognosis, but the prognosis would be even worse if the complexion were white because metal overacts on wood. Factors affecting the prognosis according to complexion. Okay. Number one, presence or absence of lustre. Number two, thin or thick color. Number three, conformity or rebelliousness of color according to face area. Number four, conformity or deviation of color according to season. And so, in chapter 10, complexion. Complexion indicating poor prognosis. Okay? One, blue as dead grass. Yellow like the seed of trifoliate orange. The black like bituminous coal ash. Red like stagnant blood, and white as dry bones. Complexion indicating good prognosis. Okay? Blue like the feathers of a kingfisher. The red like a rooster comb. The yellow like the abdomen of the crab. White like lard. And the black like the feather of a crow. Sun complexion indicating good prognosis. If the heart is healthy, the complexion is like cinnabar wrapped in thin white silk. If the lungs are healthy, the complexion is like pink silk wrapped in thin white silk. If the liver is healthy, the complexion is like azure, silk wrapped in thin white silk. If the spleen is healthy, the complexion is like the seeds of trichosans wrapped in thin white silk. If the kidney are healthy, the complexion is like purplish silk wrapped in thin white silk. Thank you for your attention.